Surgery in the COVID era, challenges, strategies, and innovations. The COVID 19 pandemic profoundly impacted surgical practice worldwide. Elective surgeries were postponed, protocols were revised, and healthcare systems adapted to ensure patient and staff safety while maintaining essential surgical services. Below is a detailed account of the key considerations, protocols, and advancements in surgery during the COVID 19 era. 1. Introduction. The COVID 19 pandemic, caused by SARS CoV 2, necessitated significant changes in surgical practice. With hospitals becoming the epicenter of care for COVID 19 patients, the focus shifted to minimizing virus transmission while ensuring the availability of urgent and life saving surgeries. This required a multidisciplinary approach and rapid adoption of new protocols. 2. Challenges in surgical practice. Resource allocation. Operating theaters, ICU beds, and ventilators were often diverted to manage COVID 19 patients. Scarcity of personal protective equipment, PPE, for surgical teams. Infection risk. Aerosol generating procedures, e.g., intubation, laparoscopic surgery, posed a higher risk of virus transmission. Risk of nosocomial infections among healthcare workers and patients. Patient outcomes. Delayed surgeries led to progression of diseases, particularly in oncology and chronic conditions. Perioperative outcomes were poorer in COVID-positive patients, with higher morbidity and mortality. Psychosocial impact. Anxiety and stress among patients and healthcare workers due to fear of infection and uncertain outcomes. 3. Surgical protocols and guidelines. To mitigate risks, national and international surgical bodies issued guidelines focusing on the following. A. Preoperative measures. 1. Screening and testing. All patients undergoing surgery were screened for COVID-19 symptoms and tested, e.g., RT-PCR, prior to the procedure. Contact history and travel history were reviewed. 2. Prioritization of surgeries. Categorization into emergency, urgent, and elective. Emergency surgeries, e.g., trauma, ruptured aneurysm, proceeded regardless of COVID-19 status. Urgent surgeries, e.g., cancer resections, were performed with precautions. Elective procedures were postponed unless delay posed significant health risks. B. Intraoperative measures. 1. PPE and safety. Surgeons and operating room staff used appropriate PPE, including N95 masks, face shields, and gowns. Minimal staff was allowed in the operating room to reduce exposure. 2. Operating room modifications. Negative pressure operating rooms were preferred, strict aseptic techniques, and limited equipment use. 3. Surgical approach. Open surgery was often favored over laparoscopy due to concerns over aerosolization. Use of smoke evacuators and filtration systems in laparoscopy and electrocautery. C. Postoperative measures. 1. Isolation protocols. COVID-positive patients were managed in designated areas. Postoperative visits and follow-ups were minimized or conducted virtually. 2. Enhanced recovery pathways. Early mobilization and discharge were encouraged to minimize hospital stay. 4. Impact on specific surgical specialties. A. Oncology surgery. Delayed cancer surgeries led to disease progression in some cases. Neoadjuvant therapies were used to bridge delays. B. Emergency and trauma surgery. Emergency procedures continued with heightened precautions. Trauma patients were managed in separate areas to avoid cross-contamination. Minimally invasive surgery. Initial hesitation due to aerosol risks, but later evidence and guidelines supported safe laparoscopy with precautions. D. Organ transplantation. Decreased organ donations and transplants during the pandemic. Rigorous screening of donors and recipients for COVID-19. 5. Role of technology. 1. Telemedicine. Virtual consultations reduced in-person visits and exposure risks. Preoperative assessments and postoperative follow-ups were conducted online. 2. Robotic surgery. Reduced surgeon-patient proximity, enhancing safety. 3. Artificial intelligence and data analysis. AI was used for triaging patients, predicting outcomes, and optimizing resource allocation. 6. Psychological and ethical considerations. Surgeons faced ethical dilemmas regarding resource allocation and balancing COVID-19 care with other surgical needs. Burnout and mental health issues were prevalent among surgical teams due to prolonged stress. 7. Future perspectives. 1. Enhanced preparedness. Development of pandemic-specific protocols for surgical care. stockpiling PPE and creating flexible healthcare infrastructures. 2. Research and innovation, studies on safe surgical practices in infectious diseases, advances in minimally invasive and robotic technologies. 3. Integrated care models, multidisciplinary care involving infectious disease specialists, anesthesiologists, and surgeons. Focus on holistic patient care, including mental health. 8. Conclusion. The COVID-19 pandemic transformed surgical practice, highlighting the need for adaptability, innovation, and resilience. While the challenges were immense, the lessons learned have paved the way for safer, more efficient, and patient-centered surgical care in future pandemics. Balancing safety with timely surgical interventions remains a priority in the post-COVID era.